Good afternoon, everyone. Welcome to this month's AFPHM webinar. Today we have Dr. Rosalie Schultz presenting on remodeling healthcare for Aboriginal people in remote settings. A reminder, if you have any questions, please use the Q&A box at the bottom located on your toolbar. Dr. Schultz will answer all the questions you have at the end of the presentation. I'll now hand it over to Dr. Rosalie Schultz.
Thanks, Terry, and thanks everybody for attending. I must say, sometimes it's when you're a bit nervous, it's hard to watch the commentary at the same time, but hopefully there'll be time at the end for me to look at people's questions or do them verbally. So I'm going to talk about remodelling healthcare for Aboriginal people in remote settings and how we can achieve sustainable development goals. And I begin by acknowledging the traditional owners of the land where we are. I'm in Mbantua, Alice Springs, which is Aranda country. So I'm a public health physician and a rural GP. I've been in Alice Springs for 15 years and been quite frustrated at our very limited biomedical approach to the lives of Aboriginal people. And so I started a PhD really very concerned about climate change and how that was going to affect Aboriginal people in particular because of their vulnerability already. But it's kind of led me a different direction unexpectedly, as happens when you work with people who are quite different from yourselves. So reflecting with Aboriginal people, I came to see that my perspective was quite a colonised perspective, kind of maintaining the structures that had set up climate change in the first place, and decolonisation of the whole process led to a reimagination of power and how colonised people could reclaim some power. And this led me to challenge our development trajectory that have led to climate change and continue to undervalue the knowledge that Aboriginal people hold. And so that's what my research has been about. And transforming perspectives on the challenge we face shows the value of shared knowledge in the health in all policies approach. So my research was with the Interplay project, which was auspiced through the Cooperative Research Centre for Remote Economic Participation. And I acknowledge the CRC and all my co-authors and all the participants in the project, government, university and corporate partners. And I also acknowledge the Fairfax Family Foundation and the RSEGP who provided me a scholarship to do this research. So my main learning outcome is that people should reconsider the position of the first Australians in Australia's development trajectory and how health and other services can work towards sustainable development in Australia. And there's kind of a map of the presentation. I'm going to talk about sustainable development goals and how we're in an ecological crisis breaching planetary boundaries in a number of areas, and then look at the closing the gap goals kind of in the light of the sustainable development goals. Then I'll talk generally about Indigenous people and the Sustainable Development Goals, then about primary health care for Aboriginal Australians, and Aboriginal aspirations for culture, health and the Sustainable Development Goals, and then finally reimagining primary health care for Aboriginal people in remote Australia. So quite ambitious. So this next slide shows the United Nations Sustainable Development Goals from the United Nations Agenda 2030, which is a plan of action for people, planet and prosperity. And the Sustainable Development Goal, or the Agenda 2030, was to strengthen universal peace and freedom, eradicate poverty and hunger in all forms and all dimensions, protect the planet from degradation, ensure that all humans can enjoy prosperous and fulfilling lives, and foster peaceful, just and inclusive societies. There's 17 goals and 169 targets that we as Australians have agreed to meet. So 193 countries have signed up, including Julie Bishop as our Minister for Foreign Affairs at the Times. And the idea of the Sustainable Development Goals is that all nations in the world have a common development goals that will share recognising our common humanity and the need for all nations to work together to develop in ways that are sustainable both for the planet and for human society. And you'll see that as health professionals, our focus goal is number 3, good health and well-being. And that's the focus of healthcare. But of course, as public health physicians, we realise that all the other goals fit into health and well-being. So in particular, the social and ecological determinants of health look at number 4, quality education, goal 8, decent work and economic growth, goal 6, clean water and sanitation, and the overall premise is that no one is left behind. Indigenous people globally have been active in development of these goals and point out how the Sustainable Development Goals interact with Indigenous livelihoods. In particular, Goal 2 about zero hunger, Goals 14 and 15 about life below water and on land, and Goal 10, which is reduced inequalities. And there you see Australia's Sustainable Development Goal dashboard for last year. So each nation is assessed annually on our progress using colours green, yellow, orange and red. And you'll see there's no green and there's quite a few goals that are red, which means we're nowhere near achieving the target. Interestingly, last year Goal 3 was green, but we've slipped behind in health, and we've also slipped behind in Goal 6, clean water, and we're now not on track to meet any of the Sustainable Development Goals. When this Sustainable Development Goal agenda was set out in 2015, we were 18th in the world, and we've now slipped back to number 37th in the world. Interestingly, the SDGs are under the Department of Foreign Affairs and Trade, suggesting that Australia still considers development to be an international or a foreign affairs responsibility rather than seeing it as a responsibility of all branches of government. We do every year put out a voluntary assessment report, and which does highlight some good work towards the goals, but overall we're in decline. So I'll just highlight there some important ones in relation to Aboriginal people. First, number 2 is zero hunger, and you might think, well, there's not very much hunger in Australia, but the reason that we do so poorly in relation to zero hunger is our high rates of obesity, with obesity being essentially a form of malnutrition. We also do very poorly because of our highly unsustainable forms of agriculture with high levels of fertiliser input. So we're doing poorly in the goal of zero hunger. We're doing poorly in Goal 7, affordable and clean energy, because of our high CO2 emissions per unit of energy. Only 8.4% of our energy is renewable. To rate green, we need to have 20% renewable. Iceland is the country that does best on renewable energy, with 78% of their energy renewable. Goal 10, we do poorly, reduced inequality. We do poorly in Goal 12, responsible consumption and production. Particularly poorly in relation to our large amounts of e-waste. We produce over 10 kilos a year of electronic waste. Poorly in climate action because of the levels of emissions, 16 tonnes per person. We'd need to be below 4 tonnes per person to be green in climate action. And finally, 17, partnerships for the goals. We do very poorly because of our very low level of commitment to foreign aid. 0.2% of our GDP with a target of 0.7%. So I think we think of ourselves as a developed and prosperous nation, but as far as sustainable development goes, we're doing extremely poorly and deteriorating. Then we see the Closing the Gap report, and likewise we're not doing particularly well as far as closing the gap, as we've continued to do poorly over the past 4 years. There's two sustainable development goals where we're sort of on target. One is early childhood attendance, which the goal was to get 95% of 5-year-olds in early childhood education by 2025, and it looks like we're going to do that. And year 12 or equivalent, it's called Closing the Gap, but in fact the goal was only to halve the gap between Aboriginal and Torres Strait Islander and other Australians reaching year 12 by 2020. And cynically, one of the reasons that we're doing not too badly as far as that is that more and more urban Aboriginal people are identifying as Aboriginal, and so that helps us get towards that goal even without doing anything for the Aboriginal people in remote Australia. And literacy and numeracy targets are not on track. Now, the concern with the Closing the Gap report for me, working with Aboriginal people, is the real focus on disparity And this sociologist, Maggie Walter, highlights the 5 Ds of Aboriginal people: disparity, deprivation, disadvantage, dysfunction and difference. And by the time you've got 5 Ds, you're really looking at people through the eyes of deficit. And when people have 5 deficits, they're viewed as being quite problematic and in need of change, rather than in need of being engaged in development processes. There are alternative indicators based on Aboriginal people's own aspirations, which might relate to things like rights of access to their lands, integrity of heritage, non-discrimination, self-determination, and imprisonment. But really, we're continuing to focus on the same deficit targets and approach. The Sustainable Development Goals do provide an historic opportunity for Indigenous people globally in the development agenda. On the one hand, Indigenous peoples are crucial agents of change with sustainable livelihood practices based on their aspirations that don't come into this global neoliberal development agenda. Indigenous peoples have their own aspirations. Many have traditional knowledge of land, seas and ecosystems. And Indigenous people fundamentally often know more about sustainability than non-Indigenous people. Then on the other hand, we see Indigenous peoples as the poorest of the poor in Australia as globally in education, hunger and vulnerability to climate change. So in Australia, sustainable development actually demands attention to the contribution of Indigenous peoples through sustainable research, through recognising the diversity and understandings of sustainable development of Indigenous people, and seeing sustainability not merely as economic or environmental sustainability, but as cultural sustainability. Health as a sustainable development goal. So in the global health community, there was disappointment that there was only a single goal that clearly related to health in the sustainable development goals. Whereas prior to the Sustainable Development Goals, we had the Millennium Development Goals, which had a much higher focus on health through the goals of reducing child mortality, reducing maternal mortality, and some disease approaches, reducing HIV and malaria. Whereas now we see health more as integrated in sustainable development as a whole, and many health practitioners are a bit disappointed at that approach since they're not sort of overriding everything. But just to look at health, the World Health Organization defined health in 1946, hopefully you're aware of this, as a state of complete physical, mental and social well-being, not merely the absence of disease. And an Indigenous consortium published a definition of health for Indigenous people in 2017 as human equilibrium in nature, with spirituality and adaptation, adjusting decisions and activities in a dynamic way with the environment. The Australia's National Aboriginal Health Strategy has a definition of health to Aboriginal people as a matter of determining all aspects of their life, including control over their physical environment, dignity, community self-esteem and justice, not merely a matter of doctors, hospitals, medicines, or even the absence of disease. There's another definition of health for Aboriginal people that we hear reiterated every time there's a new Aboriginal health strategy, as I've got there. Health means not just the physical well-being of the individual, but refers to the social, emotional and cultural well-being of the whole community, in which each individual is able to achieve their full potential as a human being, thereby bringing about total well-being of the community. It goes on. Aboriginal culture is the very antithesis of Western ideology, the accent on individual commitment, concept of linear time, the switch in focus from spiritual to worldly, the emphasis on possession and the pricing of goods and services, the rape of the environment, and above all, the devaluing of relationships between people, both within families and within the whole community, as the determinant of social behaviour of totally at variance with the fundamental belief system of Aboriginal people. So I guess I'm approaching health from the perspective of what health means to Aboriginal people and just moving further away from our ongoing biomedical approach.
To be empowered and to have our culture, and knowing your culture and being strong culture, it also helps people be healthy. It helps them live life well and be strong with what they do. Because if you've got a healthy culture, you've got a healthy body.
Oh, so just to emphasize the fact that I'm not, this is real, this is not some spiritual new age way of thinking. I'll just draw attention to this pie graph which I've created from data in a paper there, Decomposing Indigenous Life Expectancy Gap. And it's from the Health Gains Planning branch of the Northern Territory Government, who they went through causes of death in the Northern Territory by Indigenous status. And I've pulled out the data for the most recent years, 2001, 2005. And what they did is they looked at the contribution to each death of a set of risk factors using population attributable risk factor for each cause of death and different levels of exposure to each of the risk factor by age, sex and Indigenous status. And so they had this summary measure called disadvantage, which is a summary of poverty, low levels of education, poor nutrition, low birth weight, poor hygiene, nutritional deficiency. Obesity is a summary of overweight and physical inactivity. Pollution includes climate change and occupational exposures, and assault includes domestic violence, sexual abuse and unsafe sex. So what you can clearly see there is that socioeconomic disadvantage is by far the largest contributor to the difference in life expectancy of Indigenous and non-Indigenous people in the Northern Territory, contributing 41%, twice as much as smoking and alcohol combined. After disadvantage, the next largest contributor is this unexplained sector, which contributes about a third of the life expectancy gap. They also suggest that this is a combination of lack of access to healthcare due, for instance, to remote location or barriers to primary healthcare access, lack of healthy food, and lack of access to new technology. So from this data, it's clear that without addressing the socioeconomic circumstances of Indigenous people, our efforts to close the gap are very inefficient. So whatever we might achieve with our efforts to encourage smoking cessation, control alcohol and obesity, we're really tinkering at the margins without addressing disadvantage. And there are some established programs that will address disadvantage, such as the Family Wellbeing Empowerment Program. So it's not as if we don't know what to do. It's more that we're still looking at the factors that we think are important, without looking at things through the eyes of Aboriginal people. Which brings us to the subject of primary health care, which was defined at the Alma Ata conference in 1978, which was really a defining moment in healthcare, recognising that health is not a factor of medical care, but it's a fundamental human right and a global goal. Health requires action in many social and economic sectors, in addition to the health sector, as we clearly see in that pie chart I've just shown. So the Alma Ata defined primary health care and had these characteristics that primary health care reflects and evolves from the economic and socio-cultural and political characteristics of the community. Primary health care addresses the main health problems in the community, including promotion, prevention, treatment and rehabilitation. It includes education about important health problems. Primary health care extends beyond the healthcare into national and community development, food production, education, housing, public works, communications and coordination of sectors. Primary health care has maximal community and individual self-reliance and participation in the planning, operation and control of primary health care. Primary health care includes doctors, nurses, midwives, auxiliaries and traditional practitioners as part of a healthcare team to respond to the needs of the community. So Alma Ata was agreed to by many nations at the conference in 1978, but almost straight away there was a struggle to say that's too idealistic, we can't possibly do that. We're going to do selective primary health care and be economically efficient and have some medical targets. And really that's what's happened for the last 40 years. Then last year there was another global health conference on primary healthcare at Astana with some new focuses looking at universal health coverage, empowering people to take ownership, which noted it might be quite difficult given the strong power of the commercial sector in determining health, food, gambling, alcohol and tobacco. Astana really looked for some bold political choices in health, but still wanted to heavily engage the private sector.
They've trained us up in how to use tools out there. We've trained them how to use our type of things like tracking and all that.
You just go look at country and looking after the elders' country, my country, helping other people.
Knowledge to knowledge. We call it ngabadi. Ngabadi. Yeah, that's both ways. Yeah, feel good actually, yeah. You learn something new as you go. We work with the school as well, and it's like a role model thing, taking them out to like some favourite spots around these joints and showing them what we do. We're trying to encourage them to try and follow our little footsteps, like being a ranger and that. And you know, quite a few of them, they was interested. Plus it's good for yourself. It's not like you, because I don't like to sit around at the house and do nothing. You know, I like to move around and do a bit of work. It's good for your health. I reckon it's quite fun too.
Oh. Okay, so just considering the Sustainable Development Goals as an integrated development plan and what we've just heard from the Matu Rangers, we hear what the Matu Rangers are doing. They're really caring for one of the large-scale functioning ecosystems in the world, the desert ecosystems in Australia. Zimran talks about caring for his health, about fitness and education, about meaningful employment, and about transmitting knowledge to the next generation. Really wanting to support the Sustainable Development Goals of life on land. So this map here shows that almost all of the Earth has been significantly modified by human activities, but for 4 remaining areas, including the desert areas of Australia and the northern forests in Canada, Russia and Alaska, the Amazon forests and in the Sahara Desert. So Australia is really quite special, holding some of those functioning remaining ecosystems, which provide a vital refuge for ecological and evolutionary processes where there's not so much negative human influence. And it's the Matu Rangers that are caring for it for us. So in Australia, we see that much Australian biodiversity is on lands that Aboriginal people or Indigenous people still hold legal management rights and also cultural and spiritual connections. 3/4 of Australia's threatened species are on land that Indigenous people are managing, whereas there's hotspots of threatened species where the large population centres are Brisbane, Sydney, Melbourne, Hobart, Cairns. So it's Indigenous people who actually have responsibility to care for our remaining ecosystems. So even for me working professionally with Indigenous people, I was very surprised to see this series of maps. I was so focused on healthcare and medical intervention. I was really surprised to see these maps, how Indigenous people, even over my career, are really taking back Australia. So you see 1788, Australia is entirely Indigenous owned. And there was, and then up to 60, and then suddenly in 1788, it suddenly became all non-Indigenous owned. And there was no legal recognition whatsoever of Indigenous land ownership. Then 3 major things have happened since the 1960s. The first was the Indigenous land ownership legislation in 1966 in South Australia, which was compensation for the dispossession of Indigenous peoples. Then in 1967 there was a referendum that allowed Indigenous people to be included in the national census. Once Indigenous people were counted and accounted for, that was when it was realised how their health had really suffered with the possession of Australia, whereas prior to that it was really not systematically known. Indigenous people actually had the vote from 1962, so the referendum wasn't about the vote, it was about counting people in the census. And census was in fact the referendum was in fact a largely symbolic demonstration by the people that we wanted to care about Indigenous people. Then 1972, the Whitlam government was elected with commitments to Indigenous self-determination and land rights, which was a real turning point for Indigenous Australians. Whitlam's government created a special form of inalienable land that was held by Aboriginal land trusts on behalf of landowners and managed by statutory authorities. And then following these reforms, almost all states, except for Western Australia now, recognised some form of Indigenous land rights. Then in 1993, there was the Mabo decision, in which Eddie Mabo and others from Murray Island argued that their tenure system remained intact and should be recognised in Australia's common law, and failure to recognise their law was in fact racial discrimination. So the Mabo decision rejected the legal fiction of terra nullius, empty land, and raised important questions about land tenure, property rights and investment in Australia. And since then, more and more of Australia has been covered by some form of Indigenous title or management, and we see that all Australians' economic, environmental and cultural futures must strategically engage with the growing Indigenous real estate. Yet, Indigenous people still struggle to get a fair hearing about the conservation of their lands, even when they're relatively intact, and despite the growing recognition of their lands. So this map shows more clearly the state in 2013 of Indigenous held and claimed land. There's no real summary map because all these different types of land tenure and hold in different bodies. But John Altman and Francis Markham put this data together in 2013, now it's 5 years old, to show how much of Australia is actually under Indigenous ownership, management or claim. And nearly 3/4 of Australia is now in that category. Much of it in these grey stripy areas, which are registered claims. So by putting in a registered claim, Indigenous people do automatically assume some right to access the land, even while it goes through the tortuous court process. Indigenous people so now hold rights and responsibility to manage nearly 3/4 of Australia, with exclusive rights to 23%, which is the dark blue area there. And that represents about 52% of Australia's total area and 70% of their conservation estate. So Indigenous people own half of Australia and 3/4 of the conservation estate. However, as I'm sure most of you recognise where you are, most Indigenous people actually live in highly settled regions in southeast Australia. But often they too are eager to reclaim their land, their rights, and have some access to homelands. I recognise that many Indigenous people have been removed from their homelands. They still retain a strong connection to country that we settlers cannot. And one of the quotations that you hear whenever you talk to Indigenous people about land is, when the land is healthy, the people are healthy. So my research has involved focus groups talking to people about caring to country, and they talked, as we saw in the ranger there, how caring for country is caring for their health because they can access bush foods, kangaroo, turtle, goanna, bush yam, sugar bag, improving nutrition, and has an opportunity for a sustainable food supply. So going back to that sustainable development goal of no hunger, we need to consider the sustainability of our food supply. Caring for country programs recognise Indigenous people's knowledge and expertise, and there's opportunities for commercial enterprises. So caring for country contributes to sustainable development goals around nutrition, equity, and life on sea and land.
When you work on country, you're also part of the Lauren culture. We used to have about 2 or 3 different groups of young men and older men working. It's like how we encourage our people and young fellas that's been very strong in their work, well, in cultural way, as in people will see how strong our country will live, you know. So they get a lot of the practice of their law and culture stuff, and that's how it started being, you know, getting strong.
Oh,
we want to see more young kids out in the country, learning about our culture, our land, instead of being in town and caught up with all the bad things. When we're out in the country, we feel that the spirit and our elders that have gone, their spirit is with us as well and guiding us. And I want to see those young boys, girls that are mucking up to be a good person, a good leader and a role model. This is kind of, I guess, time to tell them it's hard, but it's good. You feel good.
sorry. So primary healthcare includes health promotion, and ultimately health promotion is about power, including the power to decide what is primary healthcare. For healthcare providers to empower, that means that power must expand, because we're probably not going to give up power. We need to transform the relationship by expanding the amount of power. We know that Aboriginal community-controlled health services were established to provide healthcare. Unfortunately, their real dependence on government funders has thwarted their capacity to change the dynamics and really empower people. So that's not to say they don't empower people, but there's great scope for them to do more. Unfortunately, the increasing focus on very narrow clinical KPIs is really decreasing the focus on what Aboriginal health is. If we were interested in wellbeing, our focus would be different. Caring for land and sea country, cultural education across generations. Speaking Aboriginal languages are key aspects of wellbeing for Aboriginal people in remote regions.
I'm proud because I'm Yolngo and I got a lot of families connection from Irichatua right across Sanam land. Out of that, I'll take my identity and my knowledge. Wherever I go, I can still be a Yolngo and carry my culture and show to the world. Every Yolngo right across Sanam land, we work together. And how that works, because our songlines connect, the stories, and how our the history's been connected to the waterfall, the plain, the bush, even the wind coming in. Homeland, it's like family. Like when you go back, you have to go back and see your family and live with your family. Because homeland is where you belong. Because our foundation and identity is back at home. You can't leave homeland. If you leave homeland, you've lost.
Oh.
For me and my family, I like to go out and live in the country instead being in town. Too much drink, that's what taken all our people away from their country, you know. I've been drinking, but that's gone past nearly 15, 16 years now. I've learned my lesson, and I want to see younger people do the same. When I go back to well number 6, 7, and Kaitera and all them places, I feel really at home. Sometimes during the night you get that cold wind feeling come to you, and might be the spirit of your old people, ancestors come, and you get that nice cool feeling, and you feel at home. Must be your Jamu grandfather come, must be Nana. Oh, you're right. Make you feel at home. You got your right to stay in the place. You can sense that in the, when you go there, your family there with you. Yeah.
So one of the findings of my research was really the high level of importance that people place on their languages and literacy in Indigenous languages. Indigenous literacy was associated with empowerment and with well-being, and it's part of people, and it also contributes indirectly to well-being because it's part of identity. Languages are needed to describe and communicate ecological knowledge, which is needed for caring for country. When languages are lost, ecological knowledge is lost. Thus, conserving languages is really critical for Australia to sustain its biodiversity. Strengthening languages and working towards literacy in Indigenous languages can ensure ecological knowledge embedded in those languages is sustained. I think that even as healthcare providers, our lack of recognition of language, our efforts to communicate with people in English have really been a negative impact.
I sometimes find that really difficult when you're trying to work with your own people and it doesn't get through because the dialogue isn't clear. What the government needs and what Yolngu wants. You have to come here, sit with us, spend some time, learn from us before you make things for our benefits. It needs to come from us. Let us decide what to do. It would be really good. Let the people do and decide what to do. Good employment for Yolngu would be find ways to give Yolngu freedom to run their own businesses. My name is Trevor Kurowiwi. My clan group is Galpo, and my skin group is Palang.
So well-being is a useful goal for service provision because people define their own well-being, and so there's no cultural imposition of what people might want. We define our own criteria for our own well-being based on our own values, lifeways and aspirations, really contrasting with other measures about the lives and status of Indigenous people. Interestingly, the NATSIS, National Aboriginal and Torres Strait Islander Social Survey, which is conducted regularly, has started including a question about well-being, where they ask people to rate their overall life satisfaction. And what they found was that, so the most recent NATSIS was in 2014. They showed that Aboriginal and Torres Strait Islander people in remote regions experience high levels of well-being, as 7.6, which is equal to the amount of well-being that the mean of all Australians. So despite the rhetoric about great disadvantage of Indigenous people in remote regions, they're experiencing well-being with the mean of all Australians. It's Indigenous people in urban areas who have lower levels of well-being of 7.2. What this shows is that despite great differences between Aboriginal and Torres Strait Islander people in other social measures, employment, education, health, they're actually enjoying life satisfaction when they are often on their ancestral lands. Diversity is also a cornerstone to understanding Aboriginal and Torres Strait Islander peoples who have really diverse cultures extending over very different geographies, different contact histories with non-Indigenous Australians, different environmental changes, creating increasingly diverse current realities. And one of the problems with the Closing the Gap targets is they don't recognise the diversity of Indigenous peoples, despite the fact that they try to turn these complex intergenerational challenges into a number of technical indicators. And as if making Indigenous people more like non-Indigenous people, closing the gap is an appropriate target. So I would argue that ranger and other land management programs which embody culture and promote wellbeing, working across government and community wellbeing priorities, are both a form of sustainable development and a form of health service for Indigenous peoples. The ranger programs involve things like caring for country, controlling feral animals and controlling weeds, managing fire and water, protecting ecosystems. They enable sharing of cultural knowledge across generations, so that really important aspect of education. It empowers individuals and strengthens communities. They move people away from where they have access to grog, as we heard in so many of those speakers, give them access to bush foods and physical activity. So expanding and strengthening ranger programs will provide broad-based benefits: environmental, health, employment, financial, education and community. These programs can be commercial enterprises, for example, through carbon farming, art and craft, environmental services and pastoralism. They create a positive lifestyle option for Indigenous people in the most remote parts of Australia. And cross-cultural recognition of Indigenous knowledge and aspirations will be educational for all Australians. Also, the opportunity for two-way learning, where Indigenous and non-Indigenous Australians walk hand in hand, educating one another in about caring for this land that we now share, sharing culture and expertise, empowering Indigenous people who are the strong holders of knowledge, which we are, and as settler Australians often are not. So my take-home message is that Indigenous health is the well-being of people, communities and land. Deficit description of Indigenous health really overlooks and undermines people's strengths and identity. For Indigenous people, caring for land is caring for people. Primary healthcare includes promoting intersectoral collaboration for health, including language and land. What we need are more appropriate indicators of health, including empowerment, language and access to land. And then sustainable development is a global responsibility. We need to recognise the knowledge of Indigenous people to assist Australia to reach our goals, which we've committed to, and acknowledging Indigenous authority and expertise and power. And I've got one more slide, which is this amazing painting by Yokotin Napangari, who we saw in some of the previous images, and she won the Win Landscape Art Award last year. That pictures in the New South Wales Art Gallery. And thank you. That's what I have to say.
Thank you so much, Dr. Schultz, for your presentation. If anyone has any questions, you're welcome to submit them using the question and answer pane located at the bottom of the control panel.
Oh.
So we'll just give it a few minutes to see if anyone has any questions.
Oh, thank you. Well, I must say thank you everyone for coming along. I see there's 21 people, so that's pretty exciting. So what are some key changes, KPIs we can change in our practice today? I think that we need to listen to Indigenous people. I think that there's a concern, I have a concern that Indigenous people may become like any other ethnic group in Australia, and we need to recognise Indigenous people as the first Australians with, despite what we've done to them, some important knowledge that we should be valuing. Thank you. So I do have a lot of this work published in this paper last year in BMC Health Services Research. So that was quite exciting for me, that BMC Health Services Research really recognises what these issues about Indigenous knowledge and Indigenous views of health. Oh, do you think there is an opportunity for non-Indigenous Australian population to learn from Aboriginal culture and be able to develop a connection to country? Could this help us to come together as one more sustainable and united country rather than focusing on our difference? Totally. Could we do an acknowledgement of country for every patient? I think I do. So I do recognise that many Indigenous people have been removed from their lands and don't share that knowledge and connection to country. So I think that we need to be very sensitive to that. I'm very sensitive being in remote Australia, where people have that privilege of being on their lands. Not all Indigenous people do. But of course we can do an acknowledgement of country for every patient. I think we can easily overestimate how much energy it's going to take. I mean, First Nations. Acknowledge First Nations, absolutely.
Does anyone have any more questions?
I guess how can we... So there's some wonderful work by on the Family Wellbeing Program, which was really set up in the 70s in South Australia about empowering Aboriginal and Torres Strait Islander people, and it's very interesting that it's being slowly rolled out, but there's even a sense that there's a fear of empowering Indigenous people too much. So that is an opportunity that there are established programs that do empower Indigenous people with opportunities for improving aspects of wellbeing. Do you have any related? I would contact your land council, because there's actually land councils across Australia that represent Indigenous people on the land, whether or not it's their traditional country, and they may have some ideas for you. I think stepping back and recognising that Indigenous knowledge that is not really valued, well, certainly wasn't valued in my education. And I think also opportunities to revitalise languages that may be asleep, but there's still people who have some language, and that really recognises Indigenous knowledge that is held by Indigenous people. Thank you.
Well, thank you so much, Dr. Schultz, for your wonderful presentation.
Thank you.
And that concludes today's webinar. We look forward to seeing you next month for the next AFPHM webinar. Thank you, everyone.
Thank you.